very soon we'll be going into another speaker. Is another very wonderful expert in the house, in the person of Mr. Godspower Asika. Is the national sales manager, Nigeria, FUJIFILM, Middle East, and Africa. And it's a great pleasure to have you here, on this particular platform, because we have been talking about technology. And I know when it comes to FUJIFILM, you are not behind at all. And we believe strongly that, you have so many things to discuss with. Mr. Godspower Asika is a dynamic professional with over 5 years of specialized experience in the medical device and medical informatics sectors. As an accomplished sales and marketing leader, he currently spearheads the growth of FUJIFILM, a renowned global healthcare brand in Nigeria, leaving an indelible mark on the healthcare sector. And there are so many things that we need to talk. In summary, Godspower Asika journey in the medical device and medical informatics industry, coupled with its sales and marketing prowess, underscores his commitment to advancing healthcare in Nigeria. And as a visionary leader, he has navigated the complexity of the industry, forming vital partnership and implementing innovative solutions, leaving a lasting impact on the lives of countless individuals. Great distinguished participants, I want us to welcome to the platform once again, Mr. Godspower Asika. Thank you very much. You have the floor, Mr. Asika.
Thank you very kindly. It's a pleasure to be on this platform with so many leaders in this industry, and I really appreciate the organizers for being able to reach out and making the speakers to be somewhat balanced. Sometimes I think it's really important to have people from the technology side to be able to add their voice, because we interact with the health system and at various levels. And I believe that telehealth it's really good that we're having this conversation at this point in time. But my talk today would take us a little bit back, because I would be focusing more on the digital technologies that are needed for us to be able to advance telehealth, right? And kindly permit me, I will be sharing my screen. Yeah. So let me see what I have here. So please do let me know if you can see my screen. I don't know how I can get a response to be sure that you can see my screen. Mr. Moderator, please, can you see my screen?
Not yet.
Okay. Okay. Can you see it now?
Not yet. Okay, I think it's loading. All right. Thank you.
Perfect. So I'm Godspower Asika, and I work with FUJIFILM as country manager. And so introduction of what I'll be talking about. So first of all, I'll be talking about digital health, and I'll be talking about telehealth, and I'll find a way to fuse these two together and to be able to ask some questions and also see how we react as a community, right? So digital health includes the transformation and connection of all clinical activities and workflows using digital technologies, right? So it includes everything, the entire process. When the patient comes to the hospital, how they get registered, what department they are sent to, who is going to speak with them as a consultant, what kind of tests, so to say, would be recommended in the lab or in the radiology department, and everything across the entire cycle of treatment for that patient, right? And telehealth, based on my experience, embodies everything in the use of digital health technologies for connecting the patients to the healthcare providers. So the entire technology and the entire way of connecting the patient to a healthcare provider without being physically in front of each other. That is what I think, is telehealth, and I believe it's telehealth. However, for us to be able to talk about telehealth, we need to look at the three areas in the entire continuum of care, right? Which is a circle: prevention, diagnosis, treatment. And I want to ask the audience, among these three areas, which parts do you think telehealth plays the most important role? Do you think telehealth plays, if you think telehealth plays the most important role in prevention, right? You can just type one in chat box. However, if you think telehealth plays the most important role, especially in diagnosis, you should type two in the chat box. And if you feel it's more important, more relevant in the area of treatment, please type three in the chat box, right? So the organizers, we can go through these votes and see what our audience think is the most important area for telehealth. So more food for thought, so to say. Where is telehealth needed the most between the three layers of healthcare in Nigeria: the primary healthcare, tertiary, and secondary and tertiary? Where is telehealth needed the most? And the next thing I want to ask is telehealth only relevant for rural, hard-to-reach areas? Is I understand this is the focus because we are finding ways to connect the underserved part of the population. However, is that the only relevant area for telehealth? I have an opinion that I believe that telehealth should grow more in the urban areas, because if it grows more in the urban areas, it will be stronger and it will flow to the rural areas of healthcare. And I feel there needs to be a connection. There needs to be a flow from the primary to the secondary and to the tertiary healthcare system of Nigeria. And that can only happen through digital technologies. Telehealth is a substrate, is a sub of digital technology. And until as a country we grow and advance our digital healthcare, our digital technologies in healthcare, until we digitize our health system, because there needs to be a flow from the primary to the secondary to the tertiary healthcare. And the only way to connect these three systems is through using the use of digital technologies. And I would share some of examples of these technologies in my slides. So what are these digital technologies? The first part and most important part, which I believe is that vendor neutral archiving layer, right? The foundation layer. This foundation layer can absorb and receive all form of data, right? The data could come in form of an X-ray image or a CT image or an MR image or even an endoscopy video. It could come in form of a structured report from a radiologist, or it could come from the pharmacy department showing what kind of drugs were prescribed for the patient. All this data needs to be saved in a system called a vendor neutral archiving system. Now, imagine in Nigeria where we have all tertiary hospitals connected to a VNA system, where we know that we can access and retrieve data from last year for a patient, or access and retrieve data from 2 years back for a particular patient. Imagine how much this would enrich telehealth. Being a doctor, being able to speak to someone who has had a CT scan last year or who has had a breast mammo last year, being able to get access to those data or to that data is very vital for the exponential growth of telehealth, right? And you can see the next layer after the VNA layer is all the clinical applications, all the software applications you have in hospitals, the EMR, hospital information systems, radiology information systems, laboratory information systems, picture archiving and communication systems. Then after that layer, the next layer, which I believe is the 3D advanced visualization layer and AI systems, where you're able to use artificial intelligence to screen through all the data and being able to generate new insights, to be able to know what trends, what new trends of diseases is coming up. Then at the top layer, which is the mobility or wearables layer, is where I believe telehealth exists today. That's where telehealth should be. It should be at the very top of our health system, because with telehealth, we're able to reach the far to reach areas. We're able to reach, we need to be able to get telehealth enriched with digital technologies first. So as much as we're trying to grow telehealth, we should also have a good look at how digitized is our health system. What is the percentage or the level of digitization we've achieved in our health systems in Nigeria, both the private and the public sector? This is the bedrock, this is the infrastructure for the growth of telehealth in Nigeria. And this is just to give you an example of what happens in a hospital, right? You have all these medical equipment. You have a mammography machine, a CT machine, an ultrasound. You have several clinical applications. These systems are meant not only for diagnosis, but for also for you to be able to make confident clinical decisions. And for a telehealth provider or telehealth um, company like eMobile, you need to be able to have access to this sort of access to the kind of images or insights that these medical systems will generate for you, right? And for a telehealth radiology company, for example, right, you need to be able to connect to imaging centers, to hospitals, to be able to get images of patients and make decisions and be able to put them on the treatment a treatment plan. So again, the most important layer is the VNE layer. That's the vendor neutral archiving system layer. And this VNE layer accepts all forms of data. It forms images in DICOM format, in multi-frames format, in JPEG, in every form of data you can generate from the hospital, you can save it in a VNA. And that's, I tell you, that is a very strong and very important part of being able to enrich the telehealth system in Nigeria. And this is just to give you a picture of what a VNA does, right? It can accept data from any brand, be it Fuji, Philips, GE, Siemens, any brand whatsoever, and not just X-ray and CTs, but every form of data. That is VNA layer. And of course, there are so many providers of this sort of digital technologies, and I'm pitching what FUJIFILM provides. That's the SNAPS VNA, right? But this is one area that I feel has not really been looked at, in our discussion of telehealth so far. Because yes, we need to reach those hard to reach areas, those rural areas. Thank God we have a good way. We have good connectivity or internet penetration in Nigeria, and of course there's Starlink now. So even if you get to a place where there's no internet at all, you can set up Starlink and be able to communicate with the community or with such rural remote places. But still, we need to build and develop the digital health technology in Nigeria. The digital health technology in Nigeria needs to be looked at in a holistic way, both in the public and the private sector. So this is just a little bit I wanted to share, and I'm really, really glad that I had this opportunity to share this. So thank you very kindly. Thank you.
Wow. Thank you very much, Mr. Godspower Asika. In fact, very brief, straightforward, and very concise. You have been able to really, dig into the bottom of the whole issue in just few minutes. And definitely, I think your organization is such an organization that is, needed to be partnered with because of these great technologies that you guys have been bringing forward to the healthcare technology in Nigeria. We really appreciate you for this wonderful time that you've had with us. And definitely, Fujifilm, we're not going to let you go. We're still going to come after you anytime, any soon. Particularly, just like I told Dr. Asika, that we are coming again and again because the physical event is coming up and we're going to communicate that to you. And I know that you're not going to deny us. Thank you so much, Mr. Godspower Asika, for your time. And I believe there are some questions that people are asking, and I believe it's going to be forwarded to you. You have really helped us to manage this time, and we are going to really, Appreciate you for that. Thank you so much for that. And